Hey, Kaylee, good morning. Look, you guys, each morning we're going to be speaking with doctors and experts to help guide you through something that a lot of us have really never been through before, okay, as we continue to monitor COVID-19, of course. So joining us this morning is Dr. Christopher Crow, president of Catalyst Health Network, which is comprised of thousands of doctors, okay, and Catalyst will have one of the first drive-through COVID-19 testing centers up and running today. Thank you so much for being here. Explain what this will look like.
Well, it won't be something that's very public. We're keeping it disclosed, undisclosed where we're doing it first. We're going to focus just on healthcare workers that are on the front lines. We have lots of doctor practices out there that are having frontline workers that are seeing some symptoms. And you saw from the government yesterday that that's the category that we want to test first, along with those that are at higher risk, people over 65. And so we're really keeping it to those million-plus patients that are in that category for us that are over 65 in our clinics to try to see if we can understand how to do this operation that none of us were doing a week ago.
Yeah.
Drive-through testing was not something that was on our radar a week or two ago that we're having to learn how to formalize now.
And Dr. Crow, what does the test look like? It's just a quick swab, right?
Quick swab, there's several ways to do it. You can do a nasal swab, a throat swab, and even a sputum. We're learning more about that because all the lab companies are having to spin these things up rapidly as well. And so we're learning about what's the sensitivity and specificity of these tests. This is an entire new world, and so we're trying to learn on the fly. And
so you take the test, and then how long does it take for these patients to generally get a result?
That's varying as well by the different type of equipment that's being spun up. Some are as little as a few hours, and some are 1 to 3 days. The ones we're partnering with right now are in that 1 to 3 days category, with hopefully over the next week or two, that'll continue to get better. Okay,
and then say someone gets a positive test, then what do you tell them? There's no treatment necessarily for this.
Right, and that's something the public really needs to know. There's no reason to rush out to try to get testing because it's not going to change your treatment protocol. Everything that you're seeing now coming out of the CDC this morning that you all have been reporting on, stay home. And if you have these symptoms, it's still stay home. The only reason you would need any type of different treatment if you're one of those that are having shortness of breath, some respiratory issues that you might need to end up going to an emergency room, that is the only reason we need to have people interacting with the healthcare facilities at this point.
Okay, Dr. Crow, thank you so much. We're going to chat on my Facebook page. It's Sonia Azad Health and Wellness. That's going to happen right after this show. So please do join the conversation. You'll have an opportunity to ask your questions. All right, Mark and Kara, back over to you.